So hi everyone, my name is Joanne, and I'm the founder of Heart Myo Therapy. I'm going to tell you a little story. So 12 years ago, I became a first-time mom, and that experience was both bitter and sweet. To bring my son into the world, I was in labor for 4 days, okay? Not 24 hours, it was 4 days. So for all my moms in the room, I'm sure you can really relate to how difficult that was. But even then, it was really no comparison to the difficulty we experienced as a family in the years to come. So when Evan was born, he basically cried for 8 months straight. Like every diaper change, every bath time, in the car seat, once we put him in the car, to wherever we had to go, that's when he would like stop crying, right? And so at like 8 months, the crying turned into temper tantrums. And I had to put him on timeout before 1 year old. At 2 years old, he started clenching and grinding his teeth, and he also snored. There were behavioral issues. He would go from 0 to 100 in like no time for no apparent reason, or reasons that just didn't make sense, right? And so something was off. He also wet his bed until about 8 years old. And I sought help from the lactation consultant because he had trouble nursing in the beginning. We also sought help from his pediatrician. You know, he had allergies and congestion too. We sought help from the dentist, you know, like maybe he has a tie. I'm going to talk about that in a little bit. But all these providers, you know, even though they helped like in the best way that they could, they just at the end told me it was normal. He would grow out of it, you know. And it wasn't until I looked out of mainstream medicine that I found the answers I was looking for through myofunctional therapy. And so Evan was a mouth breather, and at the root of his mouth breathing was his tongue tie. This didn't allow him to put his tongue on the roof of his mouth, which is where it should be, so that he can breathe through his nose, and he could get to the deep stages of sleep at night. Like all human beings, we need to breathe through our nose. It's innate. Mouth breathing is not normal. And so from that, his lack of sleep and not being able to sleep to the deep stages was this domino effect of all the symptoms that I mentioned, you know? So after we helped him with myofunctional therapy and addressed his tongue tie, he became a different child, you know? And so the temper tantrums, like that emotional control, it became regulated. He stopped wetting the bed. It was like pretty incredible. The day we got his tongue tie released that night, he woke up with dry pull-ups, and we were changing bed sheets every single night without fail until he was 8 years old, like at 12 to 3 in the morning. So the whole family wasn't sleeping, and it truly affected our whole entire lives. And so, like I said, he became a different child. It changed his life and it changed mine. And so that's how Heart Myofunctional Therapy was born. And today I hope children and adults, you know, get to the root causes of very common symptoms that are just not normal. So if anything that I shared resonated with you, I'm open to have a chat, you know, with you to see how myofunctional therapy can change your life or your kid's life. And that's it.
Where's Helen?